My name's Debbie, and today I'm going to talk to you about a stroke. Every year, thousands of people are affected permanently due to strokes. Today, I plan on providing you with information not only about what a stroke is, but the symptoms and what to recognize and how to help somebody when they're having a stroke. I will also provide you with an acronym that is easy to remember and will help you when you need to identify some of these symptoms. There are preventable measures that can be taken, such as going to your doctor on regular visits, getting your blood pressure checked, and getting routine blood work. It's important to know your family history, things such as hypertension, diabetes, and cholesterol problems. If you are diagnosed with these problems, you should see the doctor for not only diet and exercise, but for medications. There's an acronym which is easy to remember that I will go over today with you, which is act fast and call 911. Does anyone know what the third leading cause of death in the United States is? The answer is stroke. Doctors sometimes refer to stroke as cerebral vascular accident, or CVA. Stroke happens when there's an interruption of blood flow to your brain. That causes a lack of oxygen and food to be delivered to the tissues in your body. When the food and the oxygen is not delivered to your tissues in your body, that causes them to stop working. If you remember fast, you will know what symptoms to look for and how to recognize that somebody needs help. Let's start with the letter F. F stands for face. If you ask a person to smile and one side of their face droops, or they're unable to smile, that means that this is a sign of stroke. This is also called paralysis. 90% of all stroke patients suffer from facial paralysis. The next letter is A. Ask the person to raise their arms. If the arm drifts down or they're unable to raise one side of their arm, that usually means that that's a sign of a stroke. When somebody can't raise their arm, it usually is that they're suffering from something called hemiparesis. 80% of all stroke patients have hemiparesis. The next letter is S. S stands for speech. If you ask them to talk to you and their speech is slurred or they're unable to speak, this too is a sign of stroke. This disorder of speech is called aphasia. Slurred speech is something also that requires medical attention, and you should call 911. The last letter is T. This refers to time. It is important if a person has any of these signs that you recognize that you call 911 and get medical attention. Every minute that you delay treatment, a stroke patient can have 1.9 million brain cells that die. To conclude, besides this acronym FAST, which will allow you to recognize and get your family member or loved one help, you should also know that women have different symptoms than men. Some women will complain that they have hiccups. Some women will complain that they have general weakness or are having a hard time breathing. Most women will ignore these symptoms thinking it's something else, but it is in fact signs of stroke. Treatment is available for stroke if you recognize the symptoms within 3 hours. Every 40 seconds, somebody is having a stroke. With the tools that I provided you and the acronym FAST that you can follow, you too can recognize the symptoms and help your loved one get help and seek medical attention. You can make a difference and prevent somebody from having permanent damage or even death when it comes to having a stroke.